Hey guys, my name's Nichola Gaither. I'm a veterinarian at the Animal Hospital of Statesville, and I'm here today to talk to you guys about bloat. You know that feeling you get around this time of year when you've eaten too much of the yummy foods like your pumpkin pie and you just overindulged and your stomach just wants to explode? Well, I'm talking about that, but not about us. I'm going to talk to you about it in dogs. In dogs, we call that, the big name is gastric dilation or dilatation. And basically, that's when there is too much ingesta or air that fills the stomach really full and it gets big. And then there is an obstruction, either mechanical or functional, to the outflow, and it doesn't have anywhere to go. Risk factors for this happening in dogs, being a large breed dog, that in and of itself is a risk factor for bloating or the gastric dilation. Also, eating really large meals all at one time. That ingesta fills the stomach and it just doesn't have anywhere to go and doesn't give the body time to digest it. Another risk factor can be exercising right after a pet eats. So it's a good idea, if you've heard that saying, rest and digest, that's good. Let the pet digest their food and not go out and run with you or throw the ball. Can increase the risk of that. Also, stressful events can increase the risk of bloating. When a pet is stressful, they oftentimes do a lot of barking, which you might hear in the background. And also, they pant a lot whenever they're nervous. So when that happens, they ingest air, and so again, air fills that stomach. What can happen whenever the stomach dilates is that it can twist, and the big name for that twist is volvulus. So you may have heard the term GDV, or Gastric Dilation Volvulus, and that is a life-threatening surgical emergency for dogs. So if you think that your dog may have that, or that may be happening with your dog, seek veterinary care immediately. Signs and symptoms that you might see in your dog when this happens: it may happen after eating, but it may not. It can happen other times as well. And they may just act really restless. They may not be able to get comfortable. They may act lethargic. Actually, you may see their abdomen getting bigger. It may actually look like they swallowed a basketball. And also, they can vomit or do a lot of retching or dry heaving and nothing come up. And those are all really important signs to look for that you would need to seek care immediately. When you take your pet to the veterinarian, first they'll do a physical exam. And sometimes just by the physical exam, they can determine if your pet in fact has a distended stomach. The next thing that they'll most likely do is take a radiograph. And on the radiograph, as you can see here, this stomach is very full of air. So this is a distended stomach. And then you can see the air that shows up as black on a radiograph throughout the intestines. Ways that we can prevent this from happening. One way is to adopt a cat. Just kidding, I like dogs. But you can do things to minimize those risks, and one is to not feed a large meal. Feed small meals because the body is able to digest that a little bit quicker, a little bit easier. Wait a little time after they eat. Don't go out and exercise them right after eating. And trying as best you can to avoid stressful situations because again, when they bark a lot, when they pant, they're sucking in that air, and that can increase their risk. If you have a large breed dog, one procedure that your veterinarian can offer is a surgical procedure called gastropexy. And what that is basically tacking the stomach to the body wall. And what that does is that it doesn't prevent your pet from bloating later, but it does prevent that life-threatening twist or volvulus that can happen. So that's a preventative measure you can take if you have a large breed pet. If you have any questions or concerns, give us a call here at the Animal Hospital of Statesville. We're happy to help, and we're here to serve you. Thank you. Exercises right after it eats. Can we stop? And then it can, I don't like that. When that happens, you need to seek an emergency veterinarian to take care of that. That's bad.